Hello, welcome to PSGR. You're listening to Jodie Brunning, and today I'm interviewing Dr. Simon Thornley. Simon's a public health physician, a lecturer and researcher in the Department of Epidemiology and Biostatistics at the University of Auckland. And his research interests include epidemiological methods, low carbohydrate and low sugar approaches to diet, the link between scabies and the other important diseases of childhood, such as bacterial skin infection and rheumatic heart disease. So thank you, Simon. Thank you for joining us today.
Well, thanks for having me, Jodie. Pleasure to be here, really. I was working with a small Swedish nicotine company, and they were testing a little product, a little bit like gum, but snooze kind of thing, which you put under your lip, which was supposed to improve sort of quit success, people trying to quit smoking. And then at one stage, I just opened the Atkins book and really had, from my medical training, had been told it's a fad diet, it's, avoid it. But they were really cheap at the secondhand bookstore. So I grabbed one. And when I read it, there were these fantastically vivid descriptions by Atkins of some of his patients who are really struggling with their food. And many of the descriptions were really of somebody who was addicted. And suddenly I thought of myself and being scolded by my wife for eating all the chocolate biscuits after eating a pack. And I never intended to have one, but somehow the whole pack would disappear on the odd occasion. And suddenly I started putting my eating behavior in this kind of way of thinking about cravings, cues, withdrawal, the feeling of taking off tight shoes, something not being right. And then I would eat this stuff, certain period, the sort of habitual nature of it, the craving. And it all seemed to make sense, but it was very controversial. Sugar at the time, this is going back at about 2007, was not considered to be a major problem by public health or the medical establishment. I remember looking at this 3-volume tome that I'd had for my physician training, which was the Oxford Textbook of Medicine. I tried to figure out by looking in the index about sugar, and the only reference was in a chapter written about nutrition, and it said that sugar had been exonerated as a cause of diabetes, and that was the only reference in this $1,000 3-volume tome on sugar. And it really got me interested that this was an enormous area that we'd completely missed. Well, I was interested in addiction, and addiction is often in the nicotine world is all about the delivery of nicotine. And if you think about a cigarette, it gets inhaled in the lungs, and very quickly it's on the way in the arteries with the big surface area of the lungs, goes straight up to the brain. And cigarettes obviously fabulously addictive, whereas nicotine patches, which you put on the skin, very slow absorption, and they're not so addictive. And so my initial thought was, well, having accepted that there is something to do with food that has an addictive quality, what is that quality? And seemed to be related perhaps to glucose and the spike of glucose that you get after a meal, and that's measured by glycemic index. So you have a standardized meal of carbohydrate, and a group of people are measured in their responses in terms of the glucose concentration, average glucose concentration in the 1 or 2 hours after the meal. And so that was the whole idea of that paper, was that maybe glycemic index was responsible for this addictive property of food, and maybe that had something to do with the reason why we were all getting fat in the Western world. And it wasn't met with a lot of enthusiasm in the academic world, and particularly people who had, were heavily invested in the sort of food and nutrition space. But it rang the bells of a certain journalist for the Daily Mail in the UK, and he put out an article, and that article was syndicated around the world, and even made it on the front page of the Sydney Morning Herald. And but curiously wasn't a big thing in New Zealand, mainly I think because of the fact that glycemic index hadn't really taken off here. But it just sort of showed me how science can be kind of regional, and also it showed me how academics can completely be removed from the concerns of common people, and different audiences can give very different responses to ideas.
Yes, so the average level of sugar intake in English-speaking countries is about 40 teaspoons a day. Is that correct?
Yeah, well, that was a real revelation to me. I mean, mainly that was derived from sort of food disappearance data, which is not the most accurate data. It's actually very hard to get accurate data on sugar intake, mainly because it's in so many things. It was really like the veils had been taken off my eyes, and suddenly I could see sugar everywhere in the supermarket. It was in the yogurt, it was breakfast cereals. I had no idea that I had been eating healthy muesli that was 1/4, 25% sugar. It was just insane. So most of us don't think about eating half a cup of sugar a day. But when you actually look at the nutrition panels and see how much is in our food that we just don't notice, then, it makes sense. So this idea that food was addictive was just, I mean, it's explained a lot of my behaviors. So addiction's really, I guess, a clinical syndrome where it's associated with automatic behavior. So we don't even think about it. We just kind of need it. Also, withdrawal symptoms in the tobacco world. Most smokers, when they stop smoking, they don't say, "Oh, I've got urges or cravings," which is kind of the classic withdrawal symptoms, but they just say, "I don't feel quite right. And if I have a cigarette, that makes me feel right again." And usually those symptoms last for about a month. And if you abstain, like with cigarettes, then your brain kind of readjusts, and suddenly you don't need the drug anymore. But it's really getting over that first month, which is really tough. And so I started to notice that I had some of the same features. So tolerance, withdrawal symptoms, that feeling of not feeling right, the loss of control, the behavior that was rather erratic, associated with addiction. And it just made sense that sugar and carbohydrates, refined starches, seemed to be the real drivers in addictive food that were a problem. And so, and talking to people in Overeaters Anonymous who described basically what was like a real, what other people would associate with an episode of sort of mainlining opioids or drugs of addiction. They were doing the same stuff with food. They were kind of planning these binges, and they would just be completely out of control. They would just go over the top, feel really guilty the next morning, feel really sick. Sometimes they'd have to avoid sugar completely to try and recover. Sometimes they would get some sugar in foods that they didn't suspect had sugar, and it would bring back this flooding kind of urges and cravings. So, and yeah, there was just not a lot in the medical literature. And so I felt that, somebody had to really say something about this. It was a big deal. And yet, there was certain people could relate to it. So, for example, rat researchers would say rats will go for sweetened condensed milk over cocaine. They knew about it. Psychiatrists I talked to would say that often in the acute units, people would sort of eat the Milo by the spoonful. They wouldn't actually sort of use it in the usual manner of sort of making a dilute cup of hot chocolate. So various people could relate to it, but generally people in the nutrition world didn't like it. It didn't really fit with their model.
Yes. And the health survey in New Zealand, the 2022-2023, we have about 1 in 3 adults in New Zealand classified as obese. And that's a little bit more than just 5 years ago. Whereas the children are now aged 2 to 14. We have about 13.5% classified as obese, whereas 5 years ago, 11.6% were classified as obese. And among children, Maori and Pacifica living in the most deprived neighbourhoods are most likely to be classified as obese. So we're seeing 21.7% of Maori and 27.8% of Pacifica children. And so it seems really surprising that there is not a large cohort of researchers in New Zealand considering the role of refined starches and sugars in the diet. And we know that from a paper looking at studies 10 years ago in toddlers, amount of ultra-processed food those toddlers were consuming from an early age was between 30 and 50% of their diet. And we can only wonder what young people are consuming. And ultra-processed foods are predominantly made of refined starches, including sugar.
And so there was a few stories related to this, particularly a primary school, very inspiring primary school in Otara. And the principal was really struggling with the school. The school was kind of failing. And she decided at one point in time, really put a lot of effort into it, engaged the community, and said basically, kids can't come through the school gates with sugary food and drink. And if they do, we're going to take it off them, and we're going to give them something without those things, some healthier food. And although there was a bit of resistance, overnight, the tone of the school just completely changed, and they stopped selling the top sizes of uniform. Kids became much more engaged in the classroom and just sort of became part of the school identity.